We in the Red Cross are very aware that not only do we as a country respond to an H1N1 environment, but we have to continue to respond to disasters in that environment. Everything from our daily work to the large-scale events. And we need to make sure that we're ready not to be agents that are spreading the flu, or not that we're agents that are exacerbating the situation, that we're alleviating human need in an extraordinary environment.
When it comes to a hurricane season, when there's shelters, there's going to be screening taking place to try and identify people who are coming into shelters so that they don't infect the rest of the population. It's really important people are open and honest so that they can get proper treatment, but also so they're not going to be getting other people ill.
Over 2 weeks ago, we put together disaster management meeting in Trinidad, where we brought different national societies of the Caribbean to work with, not only with the American Red Cross, but with other members of the movement, and at the same time with different donors, to try to understand exactly what can we do better, how can we better prepare for this hurricane season. We put together a very interesting strategy for the next 5 years to develop and to move forward in building this capacity at the community level, to develop this tool, and how to add more partners, how to make sure that we're working with management agencies, national management agencies, how do we make sure that we're working with different stakeholders, and that those communities really know how to react to this type of vulnerabilities and threats, okay? And at the same time, we transforming these vulnerabilities into capacities, so, and using their own resources.
What I worried after those hurricanes did not have as big an impact as predicted was that people would become complacent and say, well, why do we need to listen next time? You need to listen because it's not an absolute science. As a government, we give our best recommendation in terms of what people need to do. And it's very important that people trust that we're going to be honest and open with the information we have, and that people follow those recommendations. Because last year's hurricane does not predict this year's hurricane.
And in a regular all hazards disaster, there's 3 things to do. Do I have my family's plan is the first step. And as Dr. Besser mentioned, there's wonderful checklists on, who's taking care of mom? And what about the neighbor next door, the elderly woman next door? Who's going to take care of her and make sure she can evacuate? And what about the dog? And all those planning steps that need to happen well before the event. Second step is so simple. Do I have the kit? Do I have what I need to grab and take from my home if I need to evacuate? Or do I have at home what I need to stay there for a number of days if I'm ordered to shelter in place? And again, wonderful checklists on those simple supplies. And then third, so important, do I know how I'm going to stay informed? I need to listen to my local officials to understand what I'm supposed to do. And then if you take those 3 steps, and in an H1 or other pandemic or an epidemic environment, add in the simple steps that Dr. Besser was referring to on hand washing or distancing, the things that people can do so simply in a regular flu environment, that is all we need people to do. And it's not as hard as I think it might be made out to be for a lot of folks.